Tonight we have a follow-up to a Contact 17 report. It involves a Bakersfield woman whose plastic surgery nightmare turned into a dream come true after a local cosmetic surgeon saw her story and offered to help.
Awful. It's an awful experience. If I had a choice, no matter to go and do it all over again, I would have never done it.
Louise Lopez is hoping her pain and suffering is about to come to an end. She claims a local plastic surgeon left her physically and emotionally scarred a year and a half ago after she decided it was time for a mommy makeover. She claims her doctor, Lawrence Birnbaum, offered her price cuts if she agreed to a tummy tuck, breast augmentation, and liposuction all at once. 2 months later, after experiencing excruciating pain, she says she went back to her doctor for help.
He goes, you get what you pay for. If you were to come into my office, I'd fix you under my contract. But you pay for cut rate service, that's what you get.
Scarring after plastic surgery is not uncommon and can be more severe depending on genetics, ethnicity, and whether a person smokes. Lopez's insurance would not cover the reconstruction. Louise thought she would be forced to live with the deep scars and pain until Dr. Darshan Shah saw our story and offered to help.
We're going to be removing all of the scars that were on her body, all the keloids, and what you don't see is the scarring on the inside of her body. We're going to have to remove all of that.
Scared to have to go through all of it all over again. You know, I know it won't be as bad this time because it's all just surface, but it's still scary, you know.
Louise developed a condition called capsular contracture in her breast, which was causing the pain. After seeing the damage, Dr. Shah was forced to remove the implants completely, and she will have to put them back in at a later time. As for the scarring on her abdomen,
what happens when we do a scar removal is we remove all the scar tissue and the skin underneath as well. So then what we're looking at is the inside of her abdomen with fatty tissue, muscle layers. We take the skin from the top and the bottom and bring it together and re-sew it in multiple layers to take the tension off of the wound. That helps the scar heal really nicely like a fine line.
How Louise's body reacts to the scarring this time will also depend on Louise. No smoking and attentive aftercare involving tape and a special scar stick developed by Dr. Shah. It will need to be used over the next few months. Now, Dr. Shah provided Lopez with his service free of charge under a charity program that he started to help families who have no options in plastic surgery cases. Louise, we are told, is healing very well and will have her implants restored once that internal scarring has healed.